His research areas of interest include psychiatry, psychiatric disorders, mood disorders, stress, trauma, dementia, bipolar disorder, uh, emotional trauma. He is a recipient of many awards, including World Association of Social Psychiatry Fellow Award 2010, Japanese Society of Psychiatry Neurology Fellowship Award 2009. Presently, Dr. Arshid is working as a professor, psychiatric medicine, Government Medical College, Srinagar. I give a warm welcome to you, sir. Over to you.
Thank you very much, Fair India and Mr. Amir Ali for inviting me for this talk. We have had a few talks before this as well in connection with the disaster activities which Mr. Ahmed keeps on doing. But as we all know that it's very vital to talk about mental health during COVID. When this whole started, when the COVID started, as Amir rightly put it, that most of the population was in absolute denial. Probably not only the common man, doctors, administrators, everybody was in denial because we thought that Wuhan is too far. None of us probably in our lifetime had been part of any epidemic because probably most of us who are functional individuals currently in various organizations have lived in post-vaccination world where vaccinations almost took away and medical science progressed in a way that pandemics and epidemics became rare. So we sort of did not have an experience. We only had historical perspective of epidemics and pandemics. I remember vividly that we should always start, if we start introspection, the introspection had to start at the highest body. So the introspection had to start at WHO. All of us will, if you go to the tweets and the information which WHO gave to you in Jan and Feb, you'll feel now that that was coming from people who were absolutely uneducated. Now, that's the kind of feeling which you get it now. In fact, lots of doctors who came on TV in Feb in India, probably, I do not blame them, but they have to take responsibility of actually creating that denial sort of, because the way they talk about the COVID without actually having the information, because it's so important for people that if you do not have information, at least shut up, do not talk. And what happened that they started talking about COVID as another flu. And that's how the people, the reaction was. So there was complete denial, if you will talk rational logic with somebody and tell him that, this seems to be scary, this seems to be much more, see what's happening in China, see what's happening in Iran, they'll say that, yesterday there was this big doctor on the TV and he said this. And then WHO said that this. And in fact, it's the, on one side, when we had the battle going on, it was immense that all of the countries, the medical professionals, all of us together tried our best to fight it out. But on the other side, we should also realize, because it's for the future, that's why I thought that we should start it from that in this age where we as human civilization have conquered the stars, reached, are thinking of setting up colonies on Mars. We had a point epidemic started in Wuhan, and it became a pan-epidemic. In spite of that, we did have everything on our hands to actually not let it happen, and we let it happen. So that is where from probably the loss of denial came in, because you did not have enough information initially available. And then the common man also, adds, and the lay media, the common man, all of that interacted to create that sort of denial, that it started coming in, it went into societies, it created havoc, it killed people, we lost lots of lives, uh, precious lives of humans to this pandemic. uh, Starting with the mental health, as all of us know that this has been, uh, many people have called it as dual epidemic. In fact, now there's this theory of triple epidemic, and I actually believe in that. It is sort of a triple epidemic. The triple epidemic, in the sense that, one, that the effect of the epidemic per se, the corona epidemic, the COVID-19, then its mental health implications, and third, its economic implications. Now, I think it definitely is, these three big spheres. There might be small other issues as well, but these are the big three which have. So it has become sort of a triple epidemic in that sense, and people generally call it now a dual epidemic. When it started getting real, when the epidemic started playing a real sense, the beyond denial, we started, the information about started coming in. So people started doing certain measures. And in contrast to what many mental health professionals think, that probably many think that that fear which it invoked, the COVID, was abnormal. But I have a contrary view to that. I think that it was very important to have the right degrees of fear. And if you look evolutionary in human beings, it has been the right degrees of fear which have led to our sustenance, which have led to our being on earth and sustaining on earth till now. It has not been any other function of the brain, but it has been purely that we feared the things which were fearful, which were dreaded, which had an implication for us as a civilization. We dreaded, and you could remember, us in contrast to other people. Started caves, which rather later on became houses. To protect ourselves from the vagaries of weather, to protect ourselves from wild animals. Doing various small things which were proportional to the amount of fear which they generated in us. And that survival instinct which came out of the fears probably helped human civilization to reach here. So it was very important to have the right ingredients of fear in all of us to actually have that kind of responses which were needed at that point of time, which meant that we needed to have some degree of physical distance from other human beings. We needed to wear masks, we needed to wash our hands, we needed to avoid social gatherings and all other things. But how could you do that? Because the essence of current human civilization is actually all about that. That's what we are as human beings, meeting each other, talking to each other, having parties, having tea. Even if we are on we are performing our duties, we still will get some time out of in the day and have tea together. uh, Dressing up in the morning, going for duties, all of those things, that changes the very essence of how we lived, and how human beings had evolved to live. uh, then functions, marriages, parties, all of that is had become the regular part of our lives, and it was suddenly taken away. And I do not disagree with the fact that it did create some degree of stress in all people. But then human beings have the tremendous capacity and capability to live with the stresses and strains of life. And in fact, when the survival becomes the issue, then the stress becomes reality. So you have to actually have the kind of stress so that the survival gets there. Because once the real threat is over, you could always actually live that normally again. Only thing is that this fear has to be in your control, and you should know that what you're doing is perfectly normal, and it has not to overwhelm you. For example, we'll go by example. Initially, we thought that uh, this COVID, as Ahmed also pointed out, that, for example, the amount of fear initially was huge. And that came because we had absolutely no information. How does it go from people to people? How does it actually, how does the disease behave? How do we treat it? All of these things, made us sort of even more fearful, because once there is unknown, the unknown is very, very fearful. In that, there's a farewell a little bit more, till we started realizing that, how does it actually move, and what is the disease like, who are the people who have uh, chances of having this illness more, and how do we actually go about its uh, what we call as control, or the management. All those things started getting better and better, and all of us also started evolving to that levels of knowledge. So what I want to say is that just mere presence of fear and mere presence of stress because of COVID in those days was perfectly normal. I do not think that that had to do anything regarding the illness. But yes, I do think that people who had pre-existing mental health issues were little bit more vulnerable to relapses, recurrences, which were also of multiple causes. One, that they couldn't actually bear the kinds of stresses they had to face during that time, or second, that their coping mechanisms, which had to be social, which had lots of social connotations, were taken away. Third, that access to medications, access to treatment also became affected. So all of that do led to problems. And also, I do agree that there were certain vulnerable individuals who might have had the mental health issues actually developing. And in West, these results were much more devastating, because that in West, the society has evolved in a way that there's a lot of trust on individuals. There are already the connections, social connections are not that strong, are that visible as you see in the East. So they will party on the weekends. On other days, they might not have time to actually meet each other. So there are limited opportunities to actually do, and they were also taken away. And once these individuals, in fact, were fighting this COVID, many of them actually were fighting it alone. But here, that you had families along with you had people calling you. You were actually, we this time were even more, if you think of this area of, you were one of the curfews where you had, luxury of phone, you had WhatsApp, you had almost everything, so you could relate to each other, you could call each other. So in that way, the kind of support structures which are present in Eastern cultures made it less stressful than probably how it happened in the Western culture. So that's why probably mental health morbidity will also, when we actually evolve it in the future, the mental health morbidity also will reflect in that way. It will not be same, as Ahmed actually talked about the physical morbidity because of the COVID. There is differential physical morbidity, even though I think that the mortality actually and mortality reported in the East is less than in the West, because there every death gets counted, every illness gets counted. It's very difficult in the populations like ours in the East. But in spite of that, yes, the mortality seems to be a little bit different. But there are reasons to that. For example, if you see that most of the subcontinent, look at the subcontinent, the average ages are in 20s, probably in India, 28 or something. In other countries, also neighboring countries, 23, 27. So, you are dealing with a huge younger population, in contrast to actually, if you look at UK, the ages are in 40s. So, all of those factors did play a role in having differential mortality. And I think that the social structures, the support system, the families, and other things, the way we live, all of those also will play a vital role in actually determining the mental health morbidity or mental health consequences of the COVID. Not denying the fact that there will be no morbidity, but saying that there will be differential morbidity. And I think that there were enough social structures in place for us to have, lesser mental health morbidity. Because, I usually say this now, this is a joke, as we had actually less fear. Probably if you look at this small place of ours, the valley, I wanted people to actually do the right things at right times. It was it's still very difficult to find somebody with mask. You look very odd now if you are walking with a mask. There are hardly any people. In fact, even initially, because probably the lack of information, the way it suddenly happened, the way the health department was overwhelmed, we did not have enough information to going to people in a way that it should have been packaged. Most of the information went for administration. Then that how the people look at that kinds of information. Um, so the medical professionals were all very very overwhelmed at that point of time. So people took it. You could see that everybody was in home whole day. Then evenings people started coming out, strolling, staying together. The very sense of what we wanted to do will be sort of defeated in many ways at many points of time. Yes, but there were still people who will feel alienated, who did not have enough support, who had pre-existing mental health issues, or who had vulnerabilities, who did feel lots of stress. In that time, I really was more concerned about the initial days when we issued lots of advisories as well. One of our advisories was about Daruk Darbar, which became very popular in Kashmir, which was our old way of actually socializing with each other without actually meeting. If you see the our old inhabitations, you'll see that these houses are very nearby, and people could easily talk through the windows, maintaining more 3-4 meters distance, and talk. And it used to happen in winters very often, because people will not come out and they will talk, particularly our females. And we thought of naming it as Daruk in Darbar rather than social distancing, which made it look very difficult. And Daruk in Darbar became very popular. You could actually talk and talk with your other families, particularly in our culture, through windows. And for others, we said that you could use in other days we tell people that it's better to make made in real rather than in the virtual world. But we also started relaxing as mental health professionals that this is the time probably you used to use the technology actually to be connected with each other a little bit more than you will in the usual sense, so that you remain socially connected with maintaining physical distance. And I do think that when we actually look at it at the larger picture, we will be able to find out that all these things did help actually minimizing the mental health morbidity. And but because now everything has plus and minus, and I also understand because we live in communities, we live in families, we live together. That also has its own connotations, because single infection will become 5 infections, 6 infections. That does happen. Now everything has its pros and cons. But regarding, because I have to be concerned about the mental health morbidity, I do think that helped in lessening of the mental health impacts of the COVID. But with the now, as that with information getting more crystallized, more informed, we know that what are the things which are to be done in order to keep yourself protected, have the risk-free behaviors. Even though I think still minuscule of population really actually do that kind of way, because it's not very easy to live such a disciplined life. It really takes a lot to live such a disciplined life. But in general, I'll say that now at least that there's that how do you actually avoid it. So this, as Ahmed said, that when you did not know, for example, somebody is sick, and in spite of that we were going and performing our duties, we did not know exactly how do we even protect ourselves, what are the ways. Now we know that you need to maintain distance, you need to wear masks, and all of that things reassure people, and do not generate huge fears, and keep people saner. Regarding children, I want to have specific points regarding children, because that was something which I thought were very vulnerable. And I think that children who were actually, mastered with lots of news, lots of TV, of hyperbolic TV at that point of time, were something which were vulnerable. But generally, because the one positive if you have of this pandemic was that the children were very least affected, less affected physically, and we started realizing that. And then children started playing also. And I think, even though you have lots of criticism of online classes, but I think that was one thing which helped children to normalize their behavior during the day. They will have at least these 2-3 hours where they will be off pandemic. I witnessed these classes with my own kids as well, and I found that very, very soothing to kids, because they will see their other batchmates, they will play, and there was not a lot of thrust on formal education, and that I think was very good for kids. But in families where kids were involved in discussions unnecessary, they were actually made to do things which they ought not to. For example, 1 year child with mask, and very scary information given to the small kids, which was not desirable. We did see certain kids which had fears which were a little bit more than usually you should have. But as it progressed all, uh, we are now at almost 1 year. We do have some solid figures to share, that what were the mental health vulnerabilities, and we found out following. With that, we will come to know that what is actual mental health morbidity in the community currently. Um, One, that we found that people initially, particularly initially, who were quarantined, administrative quarantine, and among them who were vulnerable, did have some degrees of anxieties, and which needed to be better. One, that normal anxiety of being quarantined, that's fine, but little bit beyond that, and we did see some degree of them, some proportion of them, coming to us for help. Uh, then one very, very hugely vulnerable group, which we think that once Fair India, along with other NGOs, is thinking of, and disaster management particularly is thinking of actually psychosocial work. Please consider them as well. As I said, one. The second is that where deaths happen, particularly during the initial 3-4 months. Ahmed Saab also said that, and I want to emphasize that hugely. Now, I think that was if you have one thing which probably was not done exactly according to the science, was that we knew that dead bodies do not spread the virus. We knew it of sure, and we knew what are our cultural norms and ways of actually doing, overcoming the grief. But I know that the lack of knowledge, we can't blame anybody. The lack of knowledge at that point of time, the fear of disease was so huge in all of us. It was very difficult to say something about that. But 2-3 months of initial deaths, those families seem to be the most vulnerable group to have any mental health mortality, mental health morbidity at this point of time. We had access to about 15-20 families of them, and we did find that if there's an at-risk group currently, that's that at-risk group, and we should keep on accessing them and try to address their mental health needs as soon as possible. This is the group which I talk about again and again. In contrast to probably that's what I said, that the differential morbidities of mental health in the West and differential morbidities of the mental health in the East. So this might not be true about the other places, but this is the truth about this place. Then we found also that the people who lost their employment because of the young men who lost their employment, the young men who had actually started their businesses, because there was this previous year also very difficult, and then this year also came in very difficult, and many of them did succumb to who had vulnerabilities did succumb to the mental health issues. And that's another group probably where which the non-governmental organizations which are intending to do psychosocial work in this disaster need to be very, very acknowledgement of acknowledging their this might be an at-risk group, and we should access them as well. And the third group actually was the people who had pre-existing mental, as I said at the beginning, who had pre-existing mental health issues, who were on treatments already. And as I said, they were another group which some of them had flare-ups, and there was multitude of reasons. As I said, that some had flare-ups because there was too much stress on them, which they were actually not able to handle at that point of time. And some were because they lost that social support which they were getting at regular point of time. And third, that many of them did lose the access to the systems. And fourth, that the access to medications also were lost initially. So there was some degrees of but then as soon as most of them were established, the access to health was established, access to medications were, most of them started again doing very well. Then there were probably the other groups also who had whose vulnerability to who had mental health issues post COVID. This is the group who actually had a COVID infection. Now, in them, we had people in the initial ones. You had people who otherwise had an asymptomatic illness, but the fear of disease at that point was such that they developed depressive anxiety symptoms post that, and there is a good chunk of that. But now, as it has progressed, if you see post 8 months, you see that mostly people who had a severe illness, who had near death experiences, are the ones who seem to be more vulnerable actually of developing any mental health morbidities. We also did find one. We are talking about what we call as in particular in our elderly and what we call as post-COVID delirium. We found this entity in many people who otherwise actually had their lung function seemed to be normal, their everything seems to, but they continue to be what we call as in delirious state for long after post-COVID. So what we now call as neuropsychiatric manifestations of COVID, long COVID neuropsychiatric manifestations. We're looking at that as well as probably from the research points of view, we are looking at that. So in broadly, we could say, if I have to sum it up, I'll say that the presence of fear during pandemics is a very essential feature. It has to be there, but in the right proportions, and it has to make people to do the things, because survival is very important. You do not have to think of this period. In human civilization, these periods have come, and people, you have to think of these periods as the periods of survival. And once you think of these periods as periods of survival, and not of that enjoyment, that entrepreneurships, things which you could do in normal situation, because the situation is not normal. Once the situation is not normal, you do not, once there is rain, you do take an umbrella along with you, do wear clothes which are more than the usual. So humans do these things, which are situational. So once you have an abnormal situation, you have to definitely do certain things which are important for the survival. That is how it is, and I do not think that is stretching your mental health needs to the level that the survival happens. And post survival, you could actually do all of that things. So that's one that I need to emphasize. That's perfectly normal to actually do this. And civilizations over periods of, if you look historically, civilizations over periods of times have done the same thing. That's why the human exists. So, and second time, that we cannot deny the fact that yes, COVID did have the mental health morbidities as well. The mental health morbidity did happen in COVID, and it might be differential. It might be much more in some societies. It might be a little lesser, but it is there. And then third point, which I again need to emphasize, that we do have recognized at-risk groups, and probably these are the risk at-risk groups where we need to access, and the psychosocial teams need to go, and we need to find out the vulnerable and the mortal and the morbid, and treat them as quickly as possible to resume them to the prayer functioning as soon as possible. And the fourth thing I want to emphasize, that as Ahmed said, that we are still not over it. We have lots of knowledge of COVID. I think one of the major determinants of mental health will be mental health of the whole society will be mortality. If we are able to limit the mortality and morbidity because of the COVID, all of us will have been stressed, but we will come out unscattered mental health wise. But if the mortalities increase, I again say, if the mortalities increase, that makes all other survivors, all other survivors, that makes vulnerable to mental health problems. So if you want to avoid the mental health morbidity, severe mental, we need to do all the right things, still continue doing that. in scientific ways. Probably there will be more timings to partying and all other things. We actually need to do all essentials regularly. I understand that. As I said that, probably essentialities need to be continued, but probably, we need to still limit lots of our behaviors in a way that it doesn't actually come back again in a way it did come in Kashmir in June, July, August, September. Because once there is more mortality, the mental health will be affected. So please limit the mortality, and you will see that we will come winning in the mental health way from the COVID pandemic. Thank you very much. If there are any questions, I'll be more than happy to answer them.
Thank you, sir. Thank you so much for your enlightening for enlightening us with your thoughts and experience. Definitely, we have experienced, such a huge tough time during this COVID. And regarding masks, there was this notion that this is not important, and usually if we see people just avoided it, and the person who was wearing it was literally, uh, considered as the odd one. And still, if you go outside and you can see most of the people not wearing it, but as they believe that you just have to take care of yourself, and if you are wearing a mask, you are actually taking care of the others as well. So mask should be the priority for yourself and for the benefit of others as well, because this is how we can at least ensure the safety of ourselves and others. Thank you, sir. Thank you for your thoughts. And I request all the participants, if they have any questions, they can write to us in the chat box, or we can unmute now so that they can ask, verbally as well. They can have any suggestion, they can have any question, and we have experts present here today, so you can have your thoughts on both. Anybody? Even if you are not able to, speak verbally, you can write to us in the chat box as well.
Go ahead, Javed Ahmed has raised his hand.
Okay. Okay.
Javed, I'm sending you a request. Yes, he's able to speak. Mr. Javed, you can go on.
Javed, please speak. Mr. Javed, you can speak now.
Silju, have you unmuted Javed, sir?
Yes, ma'am, he is unmuted.
There's this question in the chat. Let me respond to that till then. There's this question about fear. As I said that, like any other emotions in human beings, fear is also part of us. We have happiness, so we need, this one that we need to overcome the abnormal fears. We need not to overcome the normal fears. The normal fears, we need to have the major responses. And I will, give us a very simple example, which we give to kids usually. If there's a lion or a tiger in front of me, I need to be fearful and go inside the house and keep myself safe. But if there's a lion or a tiger in the jungle, I need not to be fearful of him. So that is how we differentiate between usually between normal and abnormal fear. So if there's a proportion of fear, so if there's a fear of fire, we know that how do we keep ourselves safe from the fire. So the measures which we do to overcome the fear have to be measured to the extent the fear is, and then that's fine. The subtle balance between the fear and the responses has to be always there. But when this balance actually shifts, when you are, for example, I am fearful, I'm alone in the room, and I still I'm wearing a mask and I'm still, doing, shaking my hands, washing my hands, and do. It does not now seem to be a rational, logical thing. But if I intend to go to my, I now intend to, after this meeting, I intend to start my office. Sort of, patients will start coming. I'll wear my mask properly. I'll keep every patient from more than 2 meters at distance. They will sit down there, and I will talk to them. I'll not see any patient without wearing a mask, and that's absolutely that. I have been doing that all. So that's how I will do that. So I will overcome my fear this way. This is my way of actually overcoming the fear. Here I am. In my home or in my office. There's nobody here, so I will not wear any mask. I will not have any sanitizer. I will not unnecessarily wash my hands till I actually need to do them. I will not go to, currently a place where there's unnecessary, I mean to say, if there's an essentiality, I will. But if there's an unnecessary meeting, which could be done like this one through Zoom, I will try to do it through the Zoom. If it's a necessity and it's very important in my medical to do it, so we'll do it that way. So that, measured responses to fear have to be important. That currently, particularly, you might have to, all of us are sort of indisciplined in a way. All of us do not want to be disciplined always. So probably this discipline in the life has to be a little bit more. We laugh about it. I few days back met somebody who had COVID, and in fact, he was detected COVID by somebody while he was sort of in a social gathering, in the sense that he was in a social gathering and he was coughing continuously, and somebody suggested to him, please, you should do a COVID test. He joked, he thought, how can I be? His rat was done right next door and it was found to be positive. Now, I saw him again partying, and I told him, no, you might be safe yourself this time, but you should have an example to others. Tell them now that this is real. See what happened to me and my whole family. All of us had to suffer that 1 month. People still do not do that. That is not being unfairful. I tell you, that is the primitive defense mechanism of denial. It's a primitive defense. It's not a human denial mechanism. It's usually animalistic, very primitive of denial. If you see something, we tell about us is that when they see a lion or a tiger in front of them, they close their eyes. They think it's not here. So it is such, you make people who are taking precautions look shameful in front of you. You think that you are very, very brave. You are not brave, because by wearing masks, by maintaining distance, you are preventing mortality and morbidity in your families, in your relatives. So having that fear is very, very important to you. So this unfearful, quote unquote, this unfearful thing is not in. Human beings are not like that. Every human being has to have right ingredients of fear, which are for his survival and for the survival of all generations. Anybody else?
We have few hands raised. Javed Ahmed talk. You can give him the.
Javed Sahab has raised his hand, but we're not. Okay, Javed Sahab can call me later on also and ask questions. It's not a problem.
Apart from that, we have also received few questions which I have.
There are few questions on fear. I thought I answered them, and there's this one question which I will again answer myself. This is about from Charanjit. Best stress relieving. For everybody to this is a general question, so we'll talk in generalities. I generally tell this to people that the three things which we can work to keep our stresses low: our thoughts, our emotions, and our behavior. Among them, the easiest thing for human beings to work with is behavior. So you can easily work on your behavior, which means that we can maintain a degree of functioning which is regular, which has a very regular pattern, which constitutes multiple things. For example, you get up in the morning, have a breakfast, have a sort of a walk, go to your duties, perform your duties, come back, meet your family, go to friends, talk. as we do routinely. And we continue doing these things in spite of how our mood is, how we are feeling that day, is very, very helpful. Doing exercise, talking to our friends, if there are stresses, talking about them, trying to find, sometimes when we get stressful, we do not get solutions easily, even though we know that this is the solution. So talking to our friends and, getting reassured from them about the stresses we are facing, and then not avoiding things, confronting them in a way that you are capable of, sleeping properly, exercising. Exercise is something which is the most underutilized, we call it most underutilized anti-stress thing in the world. Physical exercise does a lot of good to our stress, so we usually utilize it. And there are lots of other things which we do regularly, and the best is that, which I usually, because I think that lots of that we try for the best, be ready for the failures, and be content with whatever we get, and do not try to imitate. Probably those kinds of thoughts many times help us to relieve the stress and strains of the everyday life we live in.
Are we doing something about unmuting the other
No,
people who want to put in their
No,
questions?
I think we
Bilkis
have
is
this
there.
last question
Yeah.
from
Dr. Arshad.
Because I'm running out of time, I'll
Right.
answer this last question from Javed, because we are already at 7:32.
Sure,
And
sure, Dr. Arshad.
then anybody has question, you could actually send me and I'll send it. So there's no problem, because I'll
Certainly.
have to start the patient work. That's why. Javed Sahab, you are absolutely, I do think that the most relevant question which is asked by Javed Sahab is that whatever measures we think of in the context of disabilities, most of that changes completely. And in terms of kids, and in terms of disability even more. I know that, in many of them you might not be able to maintain the physical distance per se, because they need help. So there are, I do think there are guidelines now in regards to many of them, under, for example, wearing mask, making him to wear mask, cleaning your hands and his hands, and small measures like that have been found to be effective. And then actually having this consistent thing that, do not exposing them to the very high risk situations, do not exposing them to people who are at risk. But I also will say this, I know that I will have this point, that this is more said than done in societies like ours, which have been disability unfriendly from years and years. So we do not have infrastructures of type. For example, if somebody of them develops an illness, he still has come to same OPD, same hospital, which are so risky. I feel so bad when I see, particularly people with physical disabilities, when they have to come to the OPD, they have to wait in the same lounges, which are very, very high risk. And then some of them will not be able to maintain the mask as well. It does get difficult in the real situation. But I do think that there are resources available now, which could be actually taught to families, which might actually decrease the number of infections in disability. Because I do know that many of them do have immune things as well, lowered immunities and other things, and it puts them at higher risk because of COVID. I would have loved to actually interact on the everything. I'm so sorry, because I have to start because I put this because I thought it will finish by 11:30, and I put my patient work to start from 11:30. I'm so sorry.
We are very thankful. We are very indebted to you for having spared your very precious time. We understand that you have a lot of patients, and out of your busy schedule, you could be able to spend some time with us. We are highly, highly indebted. But there are a whole lot of questions. Maybe we can have subsequent sessions as well, Dr. Arshad, primarily revolving around coming out with emergency response strategies on mental health. I presume that you've already been in discussion with the disaster management division on developing some guidelines for the state.
In fact, now we could plan a session where we have only question answers about COVID and mental health.
Certainly, sir. Certainly, we will certainly plan that out. in consultation with Amir sir also. Thank you
Thank
so much, sir. It means a lot to us.
Thank you, Hinaji. Thank you, Amir sir,
Thank
for
you.
inviting me. Thank you,
Thank
Gawar
you.
sir.
Thank you so much, sir.
Dr.
Thank you
Saab.
so
Thank
much.
you, Hinaji.
So, Amir sir, while we are concluding, I think that Bilkis also had raised her hand. Bilkis, would you like to have your submission, or was that more of a query to Dr. Arshid, because now he's no longer there? If you would want to voice some of your thoughts, Bilkis.
Hello. There is some network issue.
Yeah.
No, yes,
Yeah.
yes, Dr. Hina.
Yeah,
Good morning.
Bilkis.
Yeah, I was not able to unmute that, so I was not able to talk. It was not, it was just a submission and not more of a query that I wanted to talk about is that since we are dealing with the psychosocial issues and mental health support system with respect to the COVID situation, I just wanted to have a submission that can we work on psychosocial capacity building as per the models those are available with us, so that we have a proper psychosocial capacity building in other in future we will be having more capacity building with respect to the psychosocial effects due to disasters, or for that matter due to COVID or any such kind of eventuality. If there is a possibility of that, we can start working on that and we can start progressing towards that. This is what I wanted to talk about.
It's such a wonderful idea. Thanks for putting it out in this forum and this platform. I think this is the right time for us to start working around that. And in fact, the work that you've been doing earlier also, which you've had an initial discussion with us earlier on the guidelines that you're setting up, that could also pave way and give us more broader directions on how to go about with this. So I would also say developing these multidisciplinary teams, decentralizing psychosocial, because that is a subject that we cannot openly discuss. So garbing it and hiding it under health strategies and mechanisms, for which we may have to do more dialogue with the health department, So that's how the other organizations who've been working in GNK earlier on psychosocial have been kind of talking about other things, but then it is largely has connotations with mental health, because we cannot open, there's a lot of stigma, there's a lot of no issues around that. So certainly that's a very good idea. We as a forum, SPARE as a forum, also are looking at having these different sector task force groups. So for psychosocial also, we can devise one small technical group which can start working on the strategy and the guideline development on how to strategize this, particularly because this pandemic has exposed us to some fundamental frailties, and I mean in terms of the services and facilities, and otherwise also mental health and psychosocial, which continue to be so very talked about in this. Amir sir has given an initial precedence, has talked about the impact it has had on the mind, the pandemic, and it is not very openly talked about. It is not prioritized, just like sexual reproductive health is being under prioritized in disasters. So these are some of the things that we need to talk more openly about and devise mechanisms and strategies on. So if we have more questions, we would love to have them and would appreciate people asking anything, because Dr. Arshid has just now left us. So if Amir sir can respond to some of the queries and people have, or just sharing some of their feedback, or else we can conclude the session.
Yes, Dr. Hina, can I talk? Because I'm seeing a question from Mr. Manoj, I guess.
Yes,
who has
please.
asked about, I just wanted to add to it. And we can have a meeting regarding the same. Maybe we'll have a talk regarding the same, and we can start off with something. But yes, I wanted to answer to Mr. Manoj Kar. He has asked that is there any dedicated institute in place to address the psychosocial issues for mental health in India? yes, there are institutes who are actually working on psychosocial issues, and NIMHANS Bangalore is the that is the institute who are currently working, who are taking lead and working on psychosocial issues. With respect to the disaster situations, they are leading in front, and there are guidelines which are available with NDMA. There are other organizations which are working, and our IMHANS in Jammu and Kashmir is also working on psychosocial issues for mental health in India. This is something that I wanted to talk about.
Thank you so much, Bilkis, for responding to that query. And in case we have more, or we just conclude, Gohar, are you there?
The participants can always send an email or something. If
Yeah.
they have any queries, we can always reply that.
Right, sir. Right, sir.
One point I wanted to add on is that, Bilkis brought about a very important topic of having this concept of the capacity building for psychosocial care. And we, in our process of training the volunteers and the community, as far as the disasters are concerned, we usually train them in firefighting, search and rescue, and first aid. But I think we can add a small module on psychosocial, how people can sort of identify the issues of psychosocial trauma, and then how they can redress them as para-counselors. There was a concept of para-counselors in which community is trained to act as para-counselors, so we can do that. I think we'll work together on that, have a very short module on it, and then we can include it as part of the training that we impart to the community.
That is such a wonderful idea. Thank you so much for bringing that up. And yes, there is a need for integrating this psychosocial care in the existing modules that are there for firefighting, search and rescue, and first aid. And that entails that we generate more and more awareness around this topic, which is a lot of hush-hush about it, and people tend to keep it under the cover. So with this, we come to a close of a very important and a power-packed session. And thank you, Amir sir, for providing your overall guidance and strategic directions, and for lending all the support from the being on the Director Disaster Management and a Nodal Officer for the J&K State Emergency Operations Center, and for lending your very precious time from your busy schedule by providing encouragement and support in organizing this webinar, and being instrumental in giving us some guiding lights, and talking about the context also, and the needs and concerns also vis-a-vis psychosocial. We feel deeply honored by your presence and hope your cooperation and support in future as well. I also, we've already thanked Dr. Arshid for his magnanimous presence, and he is an expert par excellence, especially on issues vis-a-vis psychosocial mental health. I am a bit concerned about these psychosocial issues which are emerging with the schools reopening and the children and the parents are also in. I wish that we can work together on seeing how best we can address this under the, I would be discussing more with Bilkis and Suhail on this. Also wish to express our gratitude to the team disaster management, especially Ms. Bilkis Dar and Mr. Mohammed Suhail, consultants disaster management, for their very important and pivotal presence and support during this course. I also wish to extend my thanks to my team at Spare India, Mr. Siljo, who's been handling everything on the back end, and all the other people who've been there providing IT and professional support for making this event a success. Last but not least, we wish to thank all the participants who've joined us for this valuable presence and staying with us during this very important session. And kindly, as Amir sir has also said, that you can please write to us on your feedback, on your suggestions, and we'd be happy to take up your questions with the experts and have these sessions again as per the need and the context. And as Dr. Arshid said, keep a separate session for only answering the queries, so we can have a question answer kind of a webinar in the coming days. We are also planning to have another our next academy session on maybe child protection, education, and talking about this school reopening, and we are in discussion with UNICEF, and we may have a subject matter expert to discuss and delve on that. So please stay connected with us for our next session as well, and stay healthy, stay safe. Thank you so much. We request Mr. Siljo, please. Yeah.
Dr.
Yeah.
Hina, I would like to make a special mention of Gohar Jilani, who has recently joined your organization. I think you did thank your team, but he needs
I am so very sorry because he is the main person who has been at the
it's
back end, and he is our DGRR fellow for the state. He is our main representative from the state. He is our face and our connection and our bridge with the state. So Gohar Jilani, the most important person who's made this meeting happen, he is the main person. I just because he's just left now, so I couldn't. Yeah. So yeah, sorry, so sorry, sir. Yeah, Siljo, I would request you to, sir, you want to say something more?
No, thank you so much. And I hope that we continue this in future also, and it will be quite beneficial for everyone. Thank you so much. And
Certainly.
I would advise that we keep it maximum up to 1 hour only, so that
Certainly.
more people can join us, because people have other things to do.
Obligations as well. Yeah.
Holiday people have joined us. We are extremely grateful to them.
We are extremely, extremely grateful to them. Siljo, you can end the meeting, please, with any administrative announcements if there are any.
Yes, ma'am. Thank you so much. So before ending, I would like to just wish to express my gratitude to Dr. Hena Hejasi, Senior Manager, Programs Peer India, for gracing the occasion with her kind words, and also for guiding and supporting, for planning and organizing this webinar. So apart from that, I would also like to thank all the participants for their valuable presence and staying with us during the entire session. A few administrative directions. All the participants can download the participation certificate from the official website of Spear India after 24 hours. The certificate for previous programs will be available soon on the website. And lastly, on behalf of JNK SEOC, Institute of Mental Health and Neurosciences and Spear India, I wish all of you a happy and safe living. We hope to see you in our future sessions. Stay healthy, stay safe. Thank you.